So this is our next psychopathology lesson. This is part 2 of depression, and we're going to look at cognitive treatments for depression. This is paper 1, along with memory, social and attachment. So to start off, I've got some recap questions. So what I'd like you to do is pause the video, have a go at these questions. So what is the ABC model? Outline the negative triad. What is the main reason for depression according to these models? And is the cognitive approach a good explanation for depression? So these questions relate to what we did in the last lesson, which was part 1, explanations and characteristics of depression. Okay, so you should have the idea that the ABC model was developed by Ellis, and it has an activating event, a belief and a consequence. If someone's suffering from depression, then this belief will be negative or irrational, and the consequence will be unhealthy. The negative triad is the idea that we have a negative view of the self, the world and the future, and this is because someone develops a negative schema when they're in their childhood from their peers or their parents or their educational background. So both of these models focus on the cognitive explanation and the idea that it's negative beliefs, and the way that we process information is different, and that is why people suffer from depression. And the cognitive approach, whether it's a good explanation or not for depression, you would relate to research support, which suggests that it is a good explanation because people suffering from depression often make errors in logic. You could also say that it puts the client in control, which is very good. However, you could say that there's alternative explanations, and it could actually be a biological cause, such as a lack of serotonin or low levels of serotonin that could be causing the depression. Okay, so we're going to look at cognitive treatments for depression, and within this we're looking at cognitive behavioural therapy. So I'll just outline cognitive behavioural therapy in general, and then we're going to look at Ellis's version of cognitive behavioural therapy. So if we have a look here, cognitive behavioural therapy, which is often called CBT, the idea of this is that it helps the client identify their negative irrational thoughts. Beck developed a type of CBT, and within Beck's CBT he wanted to identify the negative beliefs about the self, world and future and challenge these. So if someone has a negative view about themselves, you would challenge that and you would say, okay, so where has this view come from? Why do we have this view? Is this an accurate view of yourself? Where is the evidence to support this, etc.? So then we've got REBT, which is a type of therapy developed by Ellis. But before that, I want us just to recap the ABC model. So just see if you can jot down what the ABC model is, and then can you give an example of the ABC model in action? Maybe our example that we used in the last lesson was someone failing the exams. So could you give me an ABC for someone failing their exams? So your activating event would be failing the exam, your belief would be I'm useless, or I can't do this, I'm never going to pass an exam, and then your consequence would be feeling of worthlessness or low self-esteem, which in turn can lead to an individual becoming isolated, maybe not going to college, not socialising with their friends, etc. So the ABC model was developed by Ellis, and this was a cognitive explanation for depression. Ellis then developed a cognitive therapy for depression based on his ABC model. This therapy is called Rational Emotive Behavioural Therapy, or REBT. So you can take some notes, and you can see here that he developed REBT based on the ABC model. He believed that depression occurred due to irrational beliefs, and therefore we could cure someone with depression if we replace that irrational belief with a rational one. So what we do is we focus on the emotional and behavioural problems, and it's that belief section of the ABC model. So we're trying to change that belief from an irrational belief into a rational belief, and that will help someone recover from depression. So I'll go into REBT in a little bit of detail. And what we can do is we can follow this on. So we can use the letters as prompts. So ABC is the model, DEF stands for the treatment. So D is disputing. So what we need to do is we need to dispute the irrational thoughts and beliefs. And I'll explain that in a second. E stands for the effects of disputing and the effective attitude to life. So if the effects are positive, then that means that the individual is going to have new feelings or emotions, and they're going to feel much better, and they're not going to have unhealthy consequences anymore. They'll have healthy consequences. So here's some examples of disputing. So the first stage is disputing. So what we need to do is we need to challenge those irrational beliefs. And there's different ways that we can do that. So we can do this logically, so we can have logical disputing. So what we do is we say to that person, right, you're saying that because you failed this exam, you are useless. Does thinking this way make sense? Does failing an exam make you useless? So we would ask that person, does it make sense? The way that you're thinking, does that make sense? Then we have empirical disputing. And this is the idea where we look for evidence, okay? So you're telling me that you failed this exam and therefore you can't do anything. Where's the proof of this? Have you ever passed an exam before? Are there some aspects of the exam that you did really well? If there are, then your idea that you are useless and cannot do this, that's inaccurate. So we need to question that. So we have empirical disputing, but we're looking for the evidence to support that. Do we have evidence to support your negative or your irrational belief? And then finally we have pragmatic disputing. This is the idea of us asking ourselves, how useful is it to be thinking this way? So if I'm thinking that I can't do this and I'm useless when I don't pass my exam, how useful is that to me? Is that going to help me? Is that going to help me be better at this? Is it going to help me make improvements? If it isn't, and it's not very helpful, then why am I thinking this way? Maybe I need to change the way I think, and I need to think, right, okay, so what did I do well, and how can I use this exam to help me be better next time? What can I learn from this experience? Okay, so we have logical disputing, does it make sense? Empirical disputing, where is the evidence? And pragmatic disputing, how useful is thinking this way? So what we would do when we're sat with our client is we would identify those irrational beliefs, and then we would talk through with the client, and we would teach them how to dispute that belief. We would teach them how to question that irrational belief. Disputing is just kind of questioning yourself. So the therapist might initially begin by asking these questions outright to the client and then getting their answers, but then the client needs to actually take this on board, and they need to practice this, and they need to be constantly questioning their beliefs to help them identify the irrational beliefs and replace them with rational ones. So if we go through those different types of disputing, and these are effective, then the irrational beliefs will become more rational. Therefore, they move from catastrophizing, so thinking things like no one will ever like me, I will never be any good, to more rational interpretations of events. So here's an example. Say your friends didn't answer your message, or didn't wave hello to you when you waved hello at them. Someone who's suffering from depression might think, no one will ever like me, none of my friends like me, everybody hates me. So we would get them to dispute that belief. So where's the evidence of that? Do we have any proof to support that? And then we can change that to something that's more rational, like an individual thinking, my friend was probably thinking about something else and they didn't see me, or they were probably a little bit busy doing something else, that's why they didn't text me back straight away. So this makes the person feel better. So then we're thinking about our feelings. If disputing is effective, then they will feel better and they will have healthier emotions, and therefore they will become more self-accepting, and they will have better self-esteem, and they won't feel worthless. So we dispute using logical, pragmatic and empirical questions. If they are effective, then this will turn an irrational belief into a rational one, and that therefore will lead to positive feelings and healthy consequences. Some extra bits. So that's the basics of REBT, but also what needs to happen is that the client needs to complete homework between their therapy sessions. So this could be, for example, asking someone out on a date if they've been afraid of rejection, or going out and looking for a new job, or taking that exam again, doing another mock exam as practice, and it allows them to put those rational beliefs into practice. So homework has to be carried out on a regular basis. Depressed patients are also encouraged to take part in more activities, so going out with friends, going back to the gym, because this can lead to rewards, and these rewards can help that person feel better. So REBT, you've got the basics of it, but then you've got a couple of extra bits as well, and these extra bits are really important. The person needs to take on board what they learn in the therapy, and they need to practice it in everyday life if they are to improve significantly. So just to recap, we have REBT, which is Ellis's type of CBT. Within this, we have DEF, disputing, effects of disputing, and the feelings produced. There's 3 types of disputing: logical, does it make sense? Pragmatic, is it helpful? And empirical, where is the proof? And then we have to do homework and take part in other activities for this therapy to be effective. So now we've got a quick practice question. So let's have a look. I would like you to outline cognitive behavioural therapy as a treatment for depression. So you can give me the basic outline from the initial slide, which described what Beck was looking to do, or you can go into a little bit of detail about REBT. Okay, so let's have a look at the mark scheme for that question. Okay, so you can see that we've got this idea that we have to challenge the negative thoughts, we have to do homework or keep a diary, you can outline any parts of REBT, and you can talk about positive thoughts being reinforced, so changing these irrational beliefs into rational ones. There's some additional parts on the mark scheme because some of the textbooks do talk about Beck's therapy in a little bit more detail. So if you want to look through your revision guide and add the idea of the patient as a scientist, which is part of Beck's therapy, then that's absolutely fine. I'm just giving you a little bit more of a condensed version of that. Okay? So now we've got some evaluation points. So we've got the idea that we have research support. So Ellis claimed a 90% success rate for REBT. He said it takes an average of 27 sessions to complete. However, he did recognise that the therapy wasn't always effective and doesn't work for everyone. And he said that this is because some of the clients don't practice this in everyday life, so they don't practice using the disputing every day, and they don't do their homework, and therefore it isn't effective for everybody. This links to the next point, which is this idea that you have to be really open to CBT for it to be effective. If you're very rigid and resistant to change, then it's not going to work for you. You have to be accepting, and you have to be willing to question yourselves and question your beliefs and actually put a lot of effort in. So it does require quite a bit of effort, does this therapy. Ellis also said that sometimes people don't want to share their worries with the therapist, and this can be why it works better for some individuals rather than others. Some people are quite open and honest and they welcome discussion with their therapist, but other individuals don't really want to take part in this. And it can be difficult with people who are suffering from depression to actually open up, because that's not seen as a very common thing to do, and often there might be other side effects linked with the depression, like high levels of anxiety, and sometimes going through CBT can aggravate this. So then we've got some more evaluation points. We've got this idea that actually there might be better alternative treatments for therapy, and this links into what we mentioned last lesson with there being a biological reasoning behind it. Often people are prescribed with SSRIs for depression. These are a type of antidepressant. Drug therapies require a lot less effort and they're a lot faster. They get to work a lot quicker than CBT. So CBT takes 27 sessions, but if you give someone antidepressants, they could start to feel better within a week. So it's difficult because often people are prescribed antidepressants before they are put on cognitive behavioural therapy. It could be that the best thing for us to do is to use CBT along with antidepressants and not just give people antidepressants alone, and that links to the next evaluation point. And this is the economic implications. So we can see here that people with depression, they're less likely to suffer a relapse if they have CBT rather than drug therapy. So yes, initially, drug therapy may seem more cost effective, but in the long term, this individual may have several relapses. But if we give this person CBT, then we give them the skills to cope and the skills to manage their depression. Because depression often doesn't just disappear, it comes along in waves. So sometimes it might be better for us to use CBT instead of drug therapy. A combination of the two would probably be the most effective method. Okay, so our final evaluation point, if you've done like a gravy grid, you can put some application in here. It's this idea that CBT is really useful, and it's not just used for individuals suffering from depression, it can also be used by sports psychologists. Often individuals who play sport, especially sports like tennis and golf, they're very cognitive sports. There's a lot of thinking time, and you're often thinking and questioning the moves that you make, especially because it's an individual sport. There's a lot of pressure on you yourself. So we have some research here. Turner found that 9 or 10 sessions of REBT can help sports people to exchange their irrational beliefs for rational ones. So there's an example there from Nadal, just giving you an example of his rational thinking. And this just shows that if it is effective in helping individuals, not just with depression, but also identifying irrational beliefs in sport, then there must be some kind of cognitive basis with regards to things like depression. Because when we're thinking about a sports person, it could be that if they continue to have these irrational beliefs, then they could slide into depression. but if we're helping someone kind of before it starts and we're giving them the skills so they can apply this consistently, then it can prevent things like that happening. So REBT could also be seen as like a preventative measure, in certain industries, rather than just a treatment. It can also be used as a preventative measure. Okay, so just to recap our evaluation points, we have research support. So we have Ellis, 90% success rate over 27 sessions. We can see that it is economical in the long term because it helps prevent relapse and gives people the skills that they need to be better and to manage their depression in the long term. There's real life application, so it can be used as a preventative measure, and it has been used in a variety of contexts, so sport being one of those. Minuses, so limitations, it's not for everyone. It requires a lot of cognitive effort, and you have to practice your homework, you have to practice your disputing on a regular basis, and some people are very resistant to this. And also drug therapy might be a better alternative, or it might be that drug therapy needs to be used in conjunction with cognitive therapy to allow it to be effective. Okay, so to finish up, as usual, go back to classroom and complete the quiz.